Just to tie it back to the discussion around psychedelics earlier, the drugs are perhaps inspired by the chemistry that is found in the naturally occurring psychedelic drugs, but the products themselves that you are developing are not intended to be psychedelic or to have any sort of psychedelic type effects, only to induce the type of therapeutic benefit that some report from psychedelics.
Yeah. One way to think about it is that we're looking to leverage the underlying sort of biochemistry and pharmacology of psychedelic mechanisms of action, but for a drug that's more traditional in its subjective profile, so that doesn't induce these really profound sort of perceptual disturbances and dissolution of ego and these other effects.
Yeah, we rebranded at the beginning of this year, by the way. When you guys recorded that podcast, we were Xylo. And to sort of emphasize our focus on non-hallucinogenic take-home therapies, we rebranded to Xylo.
Right, the X. It's like, stay away from me, hallucinations. No hallucinations.
Yeah, I was going to say, I mean, obviously my tendency is to start talking about technical aspects of things, but when we talk about inspired by the chemistry and pharmacology of psychedelics, I think I would go so far as to say that a lot of programs that we see commercially that are looking at developing a psychedelic-like drug that is hallucinogenic, the chemotype and like the chemical structure are very similar to some of these first-generation drugs like psilocybin and maybe not LSD as much, but maybe some of the phenethylamines like DOI. And I just would love to get your one or two liner on how Xylo has taken an approach to kind of iterate far enough away where this is like a new class of therapeutics in and of itself.
Yeah. There's both a commercial reality and a sort of patient-driven sort of optimization effort away from natural psychedelics. So, the commercial reality is if you want to develop a drug, it's a very costly and lengthy process. You need to build a sufficient sort of intellectual property moat around whatever you're working on that it can, generate enough revenue to sort of cover the cost of that development. So the simplest approach is just to take a natural product itself and put it into in some cases, in my opinion, spurious kind of IP wrapper. So you might have an interesting formulation, an intranasal delivery device or something else. The next closest thing that still retains most of the properties of the drug is to look at simple modifications of the drug itself. So this might be, sticking on a single carbon atom with a methyl group, using deuteration, so a heavier form of hydrogen, to change the metabolic profile of the drug, so it can be slightly shorter acting or something else. And then all the way at the other end of the spectrum is a lot of the work that we're now doing, which is to start with a target-based approach, build out a model of the 2A receptor, and there's a number of different models available now of 5-HT2A, the key psychedelic receptor, bound to different drugs in different conformations by several different methods, and actually to use that sort of pocket as the basis for a target-based approach. So you can use a lot of sort of computational methods, including some AI methodology, to screen these vast chemical libraries, virtual libraries, and from there identify key bits of chemical matter for the start of a drug development program.
Makes sense. And so you guys you understand the potential of psychedelics, but at that time, there were a number of companies being started around psychedelics. And there were even a few that had sort of a similar kind of high-level vision, which was, let's see if we can figure out how to deliver the benefits of psychedelics without the hallucinogenic side effects like Delix and Gilgamesh and others. What did you think at that time the angle was going to be? Because obviously, anytime you're starting a company, you have to figure out how you're going to be positioned in the market different to the players that are, happening at the same time. So what was like the view in terms of how you were going to be differentiated and what your unique angle was?
Yeah, a lot of these companies were really focused on sort of simple analogs of existing drugs to achieve a sort of intended profile in the clinic, or discovery of new chemical matter from phenotypic type screens. So looking at drugs that induce certain changes in neuroplasticity in a dish full of cells. We had a pretty good understanding of the various psychedelic mechanisms and targets. And, one of the early sort of differentiators for us is that I believe we were probably one of the first commercial groups to be looking at actually building out a model of the 5-HT2A receptor that represented the structure-activity relationship work that we were doing already at that point, and using that as the basis for a high-throughput virtual screening program, which is, a technology that's really developed a lot in the last decade or so. with increases in computation and increases in the ease with which you can generate a protein structure using cryo-EM and other technologies. So that was kind of a key differentiator for us is what if we can take a target-based approach to activation, functionally selective activation of 2A in order to drive some of these neuroplastic changes and therapeutic effects in the clinic.
So rather than starting with molecules that are known to hit those receptors, it's let's just have a model of the receptor and then screen a bunch of stuff, even molecules that maybe are only theoretical and haven't ever been synthesized, and see what other interesting shapes might be able to penetrate this pocket, if you want to call it that.
Yeah, that's essentially it. You're looking for a very specific hand-shaped molecule in a glove of a pocket, essentially, to use a poor metaphor.
And so when you do it that way, when you have a model of the receptor and you do these big screenings, you're able to identify shapes that maybe don't even look anything like what the naturally occurring psychedelics look like, but still modulate the receptor and do some sort of activity there. But because they're different, probably are going to have very different experience profiles or side effect profiles or maybe even therapeutic benefits. Is that kind of the idea for why one might do that?
Yeah, that's the general idea. And it's, there's proof of concept in other programs. So Trevena with their sort of oliceridine compound that was approved, it's an agonist of mu opioid receptors. There was work coming out from Stanford, from Brian Kabilka's lab, where I spent some time collaborating, looking at this idea of not just finding a molecule that hits the target, but a molecule that activates some of the intracellular signaling of that target in a very precise way. So this has sort of been demonstrated with other G protein coupled receptors, and 5-HT2A, we believe, should be amenable to this as well.
Yeah, I think it's important to highlight that because looking at how you can activate a receptor of interest in a specific way such that there's downstream intracellular signaling, what that means for those listening is that Xylo is not just looking at what different types of molecules hit that receptor and effectively induce that change, but also in making an inference about the actual mechanism that drives therapeutic efficacy by hitting this target. And that's a very fancy way of saying a lot of companies right now that are developing therapeutics that hit this receptor maybe have good high-level guesses about the mechanism, but there hasn't really been a very intense, concerted effort to delineate the mechanism of a specific analog or a specific new class of therapeutics that hits the receptor. And obviously I'm doubly biased here, but I think that in the past 4 years, you've not just done a ton of medchem and looked at SAR, you've also built this platform that helps you make more in-depth inferences neuroscientifically, but also in other ways as well. So if you could generally talk about how the platform has been built around this too, or maybe not just that, but what other tools that you're using in translational psychiatry that are helping you get to a more precise definition of what's happening. That could be very interesting too.
Yeah, so one of these sort of knowledge gaps that exists for, this is essentially a first-in-class drug, XYL1001, because it's the first non-hallucinogenic selective 5-HT2A agonist that's been commercially developed as far as we're aware. And we don't really know what the profile of that drug should be, right? So we've spent a lot of time, we expect it to be similar in some ways preclinically to things like psilocybin, which also activates 2A and other targets, well-known psychedelic, but we also expect it to be different in important ways. So a lot of the work that we've done to date has focused on understanding, at a precise sort of molecular level, how activation of this 2A target by this chemical is driving different processes in biological systems. And this includes, in sort of cellular pharmacology at the receptor level, in whole cell systems using various neuroplastic measures, and even in animals. So we've spent a lot of time looking at behavioral models that are well understood in translational psychiatry, typically in rodents, but also some of these sort of transdiagnostic models that are not so frequently used for drug discovery, at least. So by transdiagnostic, I mean models that can explore the ability of a drug to treat a symptom that's maybe common across diseases. So we have various models now in rodents for things like cognitive impairment is a good example. And we have various tasks that we can set up and have a rodent perform that give us some idea about how rigid the rodent's cognitive capacity is. And sort of rigid cognition is one of the features of a lot of mood disorders, for example. I think Robin Carhart-Harris was talking about it at this conference last week as canalization. So the idea that you get these rutted sort of grooves in thinking and behavior. Taking a more sort of rounded approach to relevant mood disorders instead of just using the same suite of models that have been used historically in psychiatry with, sort of limited predictive utility.